guys. For the Q&A today, I'm going to answer your questions about a skin condition called granuloma annulare. You all asked me a fair amount about this and if I could do a Q&A on it. Granuloma annulare is a fairly common inflammatory skin condition that presents as these firm little skin-colored to pink bumps that can be by themselves, kind of scattered about, or most classically are grouped in ring shapes, hence the name annulare. Annulare means ring-shaped, annular. If you're watching this, chances are you want to know, is this going to go away, and or what can be done to get rid of it? So before I get into the outlook of the skin disease and the treatment options, let me tell you a little bit about the different types of granuloma annulare, because each of the different types has a slightly different outlook. The most common type of granuloma annulare is localized granuloma annulare. This presents as these firm bumps, like I described, most often on the extremities, like the ankles, the wrists, and is more common in young children. The second type is more common in adults, and it is called generalized granuloma annulare, and unfortunately, as the name implies, it has a more generalized, widespread distribution, most often on the trunk, but also can include the inner thigh area, the extremities, and it is more common in adults. Then there is a third type called subcutaneous granuloma annulare, which is more common in very young children, and really all that looks like is this firm, rubbery nodule under the surface of the skin. So it looks quite a bit different. Again, more common in very young children. A fourth type is one called perforating granuloma annulare, in which the skin disease process actually comes to the surface of the skin, and the underlying destroyed skin from the disease actually gets extruded to the surface of the skin. It's called perforating granuloma annulare. It presents as the skin-colored bumps, most often on the backs of the hands, but in the center of the skin-colored bumps, you have this little kind of crusty material, almost looks warty, and that is in fact the extrusion of degenerated collagen from the deeper layers of the skin out to the surface of the skin. Granuloma annulare, when we do a skin biopsy of it, no matter the subtype, one of the hallmark feature of it is that it occurs deep, the process of the skin disease occurs deeper in the skin, in the dermis. And part of that process is actual degeneration of the collagen in the deeper layer of the skin there. And so it is a disease that happens in the dermis, not the top layer of the skin. Now, if you have granuloma annulare, what might you expect as far as it going away? In the cases of localized granuloma annulare, which tend to be more often in children, these cases, 50% will spontaneously go away in 2 years with no treatment. 50% will go away with no treatment in 2 years. But those skin lesions, they can stick around anywhere from a few weeks to decades. It's incredibly variable, but kind of right down the middle of the road as far as what you might expect is they'll be gone with no treatment in 2 years. If you have generalized granuloma annulare, unfortunately the generalized type of granuloma annulare is much more stubborn, sticks around a lot longer, and is really difficult to treat. It tends to be refractory to treatment, and when it goes away, it tends to come back, unfortunately. The subcutaneous granuloma annulare, those rubbery nodules that young children can have, that tends to go away on its own as well. So the adult form, the generalized form, tends to be the more stubborn. That's what you should know about the different forms. What can be done as far as treatment to get rid of this skin disease? The localized form, the first step in treatment is usually to do nothing because, as I said, most cases will spontaneously resolve with no treatment. But unfortunately, it can stick around for a while, and these skin lesions, they're bothersome. They, while they're not dangerous, they tend to not have any symptoms associated with them. They really bother the patient, so we want to try and help get rid of it faster. So one of the most common things that is done is to prescribe a really, really strong steroid cream that the patient patient puts on the skin lesion and covers with a really tight bandage. They do this anywhere from 4 to 6 weeks, and the idea behind doing it under the tight bandage is to really drive that steroid medicine into the deeper layers of the skin. If you just put it on the surface of the skin and let it hang out there, it won't get down deep in the skin where it needs to be. And as I said at the beginning of the video, granuloma annulare, it happens in the deeper layer of the skin. That's where the skin disease process is occurring, not on the top of the skin. So we have to try and drive that medicine cream in, and usually we do that by occluding it under a bandage. In the meantime, the patient is also coming into the dermatologist on somewhat of a regular basis and perhaps getting intralesional steroid injections directly into the skin lesion. This involves a needle injection into the dermis to just shoot that medicine into where the skin disease process is going on in the hopes of calming it down and getting rid of it or making it go away faster. Outside of topical and intralesional steroids, the other type of treatment for localized granuloma annulare that might be considered is cryotherapy, or the liquid freezing spray. Unfortunately, cryotherapy can result in the skin lesion going away and healing with either hyperpigmentation or hypopigmentation, meaning either a dark spot or a dark stain, or taking the color of the skin away with it. And neither of those are desirable outcomes, so that is often not pursued. Another type of treatment that might be considered for localized cases most often is laser therapy. Two types of lasers can be very useful. One is the pulse dye laser, which kind of treats some of the blood vessels that come in as part of the inflammation that's going on with the skin disease. And the other type of laser is one called excimer. And both have shown variable success rates with getting the granuloma annulare to go away faster. Now, what about generalized granuloma annulare? Is there anything that can be done to get rid of this faster? One of the most common pursued treatment options, and tends to be the most successful, or met with variable success, but tends to be more likely to be successful, is to do something called narrowband phototherapy with narrowband UVB phototherapy. This is done by a dermatologist. Not all dermatologists do this because it requires some equipment, and so not all dermatology offices will have a phototherapy unit, but many do, and this can be offered. And the success rates are variable, but it tends to be one of the more successful treatment options for generalized granuloma annulare. Either that or another type of phototherapy called PUVA phototherapy, which utilizes UVA and a medicine called psoralen to make the skin lesions very sensitive to the UVA, and that can help to get rid of the skin disease faster. When I say phototherapy, I'm talking about phototherapy with either UVB in the case of narrowband or UVA. These are both types of ultraviolet radiation. And you may be alarmed at that because I'm always cautioning you against excessive sun exposure and very, very much encouraging you to stay away from the tanning bed. But I will emphasize that phototherapy is not the same thing as going out in the sun or going to a tanning bed. It utilizes very select wavelengths of ultraviolet light and at very, very calculated doses under supervision by the dermatologist for skin response to minimize skin damage, but utilize the properties of ultraviolet radiation to treat and destroy the underlying pathology in the skin. Some people have good success with a course of oral isotretinoin. Isotretinoin is Accutane, commonly known as Accutane. For whatever reason, that has been reported to be successful in some cases of generalized granuloma annulare. Also, medications in the class called antimalarials, namely hydroxychloroquine, which commonly goes by the name Plaquenil, or chloroquine, have been used to treat generalized granuloma annulare, again with variable success. So those are some options that might be pursued by your dermatologist, but do know it's kind of a guessing game as to whether or not the skin disease is going to respond to them, and oftentimes multiple attempts are needed and multiple different treatment options are trialed, either in combination or alone. And unfortunately, even if the skin disease goes away, it can still come back. So it's a really frustrating skin disease to cope with. And while it is not typically symptomatic, there's not typically any itching or pain or discomfort, It's cosmetically bothersome to the patient, and that can affect your self-esteem. So we want to do everything possible to help make it go away faster and to get rid of it. You know, this skin disease was described in the 1890s, and it was first named in like 1905, yet we still don't know what causes it or how to get rid of it in a precise way. So that's very frustrating, but it's been around for a very long time. There are a lot of theories out there as to what causes granuloma annulare. It's thought to be kind of an abnormal immune response to some sort of trauma or insult in the skin. It's not unusual for it to be reported, for example, after a bug bite. So it may be an abnormal reaction to a bug bite. Also, it's been reported after getting over a variety of different common viral illnesses. Like a common cold, unfortunately, can trigger this in some people. And there is some association with type 1 diabetes as well as type 2 diabetes and thyroid disease. But you know, it's not as though people with those diseases will get this, and it's not as though people with granuloma annulare automatically have those diseases. It's just an association that's been reported. It's also been reported in association with HIV, as well as with a variety of different medications. And importantly, one thing I didn't point out when I was talking about how it looks, it often has a predilection for sun-exposed areas of the body, and it's thought actually that it may be an abnormal response, skin response to ultraviolet radiation. It also tends to occur in areas where there's a lot of photo damage. If you think of it, that makes sense because ultraviolet radiation from the sun and photo damage, it starts to destroy the collagen in the deeper layers of our skin. And so for whatever reason, some people's immune system may react to that you know, kind of in a funny way and causes skin lesions called granuloma annulare. So that's another potential association. And then rarely, more likely in older adults, for example, it has also been reported in association with a malignancy, namely, in other words, cancer. Most commonly cancers of the blood like lymphoma, leukemia, as well as some solid organ cancers like breast cancer or cervical cancer, for example. But do know the majority of cases of granuloma annulare happen in people who are otherwise healthy. So if you have the skin disease, you know, don't worry that you have cancer or HIV or more grave associated disease. That's merely been reported, but the vast majority of people are otherwise healthy. From the perspective of dermatologists, really what we need is a skin biopsy, because we need to look at that area of the skin and the deeper layer of the skin to confirm the diagnosis. Actually, there are a lot of things in dermatology that look exactly like granuloma annulare and are not it. And for example, the subcutaneous granuloma annulare that I mentioned at the beginning of the video, those rubbery nodules that kids can get, that actually looks an awful lot like some of the skin findings of people with rheumatoid arthritis, a totally different disease. And actually, many kids who presented with subcutaneous granuloma annulare, they have been misdiagnosed as having rheumatoid arthritis, when in fact they had subcutaneous granuloma annulare that spontaneously will go away most often in that subtype, and they didn't have rheumatoid arthritis. So it's really important to get the right diagnosis, because those kids were put on, you know, medications for rheumatoid arthritis, a disease they did not have. There are a lot of other diseases, like I said, that look like granuloma annulare. So that's really the main thing that we do to diagnose it. Blood work typically is not needed unless we suspect one of these rare associations, like HIV, for example, based on your history. But for the most part, blood work is not needed. No fancy imaging is going to be needed, most likely, like an MRI or CT scan. It's really the skin biopsy to confirm the diagnosis in suspected cases and to rule out other things. So hopefully that answered all of your questions about granuloma annulare. It's very frustrating to cope with because it does stick around for a long time. It's very stubborn, it's very resistant to treatment, and we really don't have a solid understanding as to what causes it. But do know that in the vast majority of cases, the person's otherwise healthy, and it by itself, the disease process by itself, is not dangerous. It's not going to put you at risk for cancer or anything like that. So, I wish I had better answers for you as far as how to get rid of it. But I hope this video was helpful to you guys out there coping with this skin disease. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.